Welcome to Seattle Cancer Care Alliance. In this video, we're going to walk you through how the Fred Hutch Bone Marrow Transplant Program at Seattle Cancer Care Alliance will support you. The information is meant to be an introduction and doesn't replace a conversation with your physician. Please keep in mind that your transplant experience will be unique because you are unique. Your experience may differ from others based on your specific disease and any other medical challenges you may face. We will design a personalized treatment plan that meets your needs.
I'm Dr. Marco Milsarek, Medical Director of the Fred Hutch Bone Marrow Transplant Program at Seattle Cancer Care Alliance. SCCA is a unique alliance of Fred Hutch, Seattle Children's, and University of Washington Medicine, three world-renowned powerhouses in cancer care that came together to create one of the nation's top cancer centers. I'm also an attending physician and a researcher in the transplant program. As an attending physician, I care for patients receiving transplants. And as a researcher, I'm determined to make transplants safer and even more effective. I'm proud to say that patients receiving transplants here consistently have higher survival rates than those reported at most other US transplant centers. This is due to our experience, commitment, and ongoing improvements through research. Bone marrow transplantation started right here. Doctors at Fred Hutch performed the very first bone marrow transplant in 1973 under the direction of Nobel Prize winner Dr. E. Donnell Thomas. Dr. Thomas's groundbreaking work led to dramatic advancements in cancer care. Today, our transplant teams have performed more than 15,000 blood stem cell and bone marrow transplants, more than any other institution in the world. We also have a long-term follow-up program that provides lifelong support to each and every person who receives a transplant at Seattle Cancer Care Alliance. The research, expertise, and commitment behind our approach to long-term follow-up remains unmatched. We are still supporting thousands of patients, some who received transplants decades ago, who live far away from Seattle. All of this makes our program truly unique.
Transplant is an intensive treatment. Before your treatment begins, you will want to have the right support in place and finalize plans for housing, transportation, and treatment costs. You'll need to have one or more caregivers with you throughout the transplant process, unless you are admitted to the hospital. A caregiver provides around-the-clock monitoring, emotional support, and physical care. Some patients may have one main caregiver, and some patients may have a team of caregivers made up of family, friends, and professionals. Before treatment starts, your team will ask you for a written caregiver plan and schedule. You and your caregiver will attend classes and one-on-one teaching sessions where you will learn what to expect during the transplant process, how to prevent infections, manage symptoms, prepare food safely, and care for your central line. For your safety, while you're being treated with us, you'll be expected to live within a 30-minute drive of SCCA's outpatient clinic. If you are coming to Seattle from out of town, we recommend that you arrange temporary housing as soon as you know your arrival date. There are two residences near SCCA's outpatient clinic that accommodate extended stay housing for patients and their families: SCCA House and Pete Gross House. Pediatric patients and their families may choose to stay at the Ronald McDonald House, which is located near Seattle Children's Hospital. If you choose to find different accommodation, there are a variety of hotels and extended stay options within a 30-minute drive of our clinic. We offer free shuttle services during weekdays. The shuttle provides round-trip transportation from SCCA's outpatient clinic to the University of Washington Medical Center, Seattle Children's, SCCA House, Pete Gross House, and local grocery stores. Our shuttles do not run after business hours, on weekends or holidays, so you'll have to make other plans for transportation during these times. You'll also want to sort out your treatment costs before you arrive at SCCA. Navigating the cost of a transplant can be challenging. Seattle Cancer Care Alliance has patient financial coordinators on staff that help you understand your treatment costs and insurance coverage. When you arrive for transplant, you will meet your transplant team and begin the process of your medical evaluation. This includes a series of medical tests and procedures that will evaluate your health and disease status. This testing takes about 2 weeks. After the evaluation is complete, your attending physician will talk to you about your test results and treatment plan. During this conversation, the physician will go over the risks and potential complications of your treatment and tell you how long you can expect to be in our care. In general, the amount of time you spend in our day-to-day care ranges from 2 to 4 months, depending on the type of transplant you have and how you respond to it. Treatment time for an autologous transplant, when your own cells are used for your transplant, is about 2 to 3 months. Treatment time for an allogeneic transplant, when donor cells are used for your transplant, is about 4 months. While you may be scheduled for some appointments at Seattle Children's, SCCA Hospital, or a specialized unit at University of Washington Medical Center, most of your appointments will take place in our transplant clinic on the 6th floor of SCCA's outpatient clinic. Our reception area overlooks South Lake Union and has isolation areas for those needing separation from others due to infection risks such as cold or flu. If you are new to SCCA, one of our nurses will offer you a tour when you arrive. During your medical evaluation and treatment, the schedule can be very intense. For example, some weeks you may visit the clinic for several hours every day, including the weekends. Some weeks you may come into the clinic less often than that. We will see you as frequently as you need to be seen. Your schedule may change on short notice depending on your response to therapy. You and your caregivers are the most important part of your care team. Your care team also includes an attending physician, an advanced practice provider who is a nurse practitioner or physician assistant, team nurses, scheduler, pharmacist, dietitian, and social worker. Each person specializes in working with transplant patients. Your team meets daily to discuss your transplant care so each person knows how you are doing and can quickly adjust your treatment plan if needed. You may meet more than one attending physician or advanced practice provider while you are in our care. This is because our attending physicians and advanced practice providers spend time in the clinic and in the hospital. Our physicians are also scientists who research ways to cure cancer. When a new attending physician or advanced practice provider joins your team, they have been briefed on your care and know your treatment plan. Your team nurse will meet you on the day you arrive to the transplant clinic and is your go-to person throughout your care. To help manage your treatment, your team may reach out to other medical experts throughout our clinic, including infectious disease, dental medicine, and pain services. We also have teams who provide practical, emotional, and social support, such as physical therapy, child life, interpreter services, and integrative medicine. Our program created a unique model that allows us to provide your medical care at SCCA's outpatient clinic as much as possible. That means you get to spend more time in a home setting, which can be more comfortable than a hospital room. At Seattle Cancer Care Alliance, we can support most of your transplant care here in our clinic. Other areas in our building that you may visit include the lab, imaging, procedure suite, apheresis unit, infusion room, and pharmacy. Anytime you need to reach a transplant specialist, you can. During daytime hours, our triage nurses provide care in person or over the phone for urgent issues, such as symptom or fever management. We also have a dedicated team of after-hours transplant providers. If you need to be hospitalized, our transplant teams at SCCA Hospital, University of Washington Medical Center, or Children's will take care of you. The people on your care team at these hospitals will be different from your team at SCCA's outpatient clinic, but all of them are experts in transplant care. Before you are released from the hospital, our transition nurses will prepare you to return to your team at SCCA's outpatient clinic and coordinate your care needs and follow-up appointments. This helps ensure a smooth transition between the hospital and the clinic. While in our care, we're here for you 24 hours a day, 7 days a week, 365 days a year. As you approach the end of your day-to-day transplant care with us, we will prepare you to return home to your referring physician. We will teach you about our long-term follow-up program and how to care for yourself in the weeks, months, and years after transplant. You might not return to work or other activities immediately because you have a higher risk for infections, may still have symptoms, and may not have a lot of energy. Our one-of-a-kind, well-established long-term follow-up program provides lifelong monitoring and care after your transplant. The team works in partnership with you and your physician and will consult with you for any medical issues you may have related to your transplant. After your transplant, we are here to support you in lifelong care. We hope this video helped you learn more about how the Fred Hutch Bone Marrow Transplant Program at Seattle Cancer Care Alliance will support you. We look forward to hearing from you.